And I think a lot of people ask me like mindset and cancer and these things that I've gone through and that many people have gone through. And I really believe that if we always have this belief in something greater than ourselves, and then we also believe that there is more possibility than what we see right in front of us, it does affect outcomes. And for me, when I first got diagnosed with breast cancer, of course, I was 25 and I did not know if I was going to live or die. I could have had 6 months or 6 years or who knows. But in the beginning, I remember on the radio hearing a pastor that talked about, I can't remember even the sermon that I heard, but in the end, I remember a verse, and it was, "This sickness will not end in death, but it's for the glory of God," from Luke. And I remember just like hearing that. And for me, it was a word that I received and heard so clearly. And from that moment, I just knew in my heart that I was going to survive and that if I survived, I had to look at this as a way to how can I bring God glory in my life through this experience.
Welcome to Vitality Made Simple. The following production is for educational and entertainment purposes only. If you need medical advice, call your doctor. Now, let's go to Vitality Made Simple.
Welcome to Vitality Made Simple. This is the podcast that equips you to feel better, look better, and to enjoy better relationships. And I've got a friend here. She's a friend of mine. I don't think she knows me, but this is Dr. Jill Carnahan, one of the smartest and absolutely nicest people that I've ever met. Whenever she's lecturing at the American Academy of Anti-Aging Medicine, I always am on the front row because she always has new insights and quite a distinct vulnerability that a lot of practitioners don't have. Welcome, Dr. Jill Carnahan.
Thank you, Debbie. I'm excited to be here with you.
Well, I appreciate it. Dr. Jill just got in from London, lecturing there, and was kind enough to see us today. So listeners, you're in for a treat. Now, Dr. Jill, you have a wonderful book that I love called Unexpected, aptly named because you've had a lot in your life that's been unexpected. So tell our listeners about that.
Sure. It's so funny because now I know I was clearly born to be a healer. And most of us in this journey, we have a story. So I'm not unique. And I love telling my story because I think it gives permission to those out there who are like, should I write a book? Should I tell my story? The answer is yes, because you have a story too. And I think it's just as important as mine. But unbeknownst to me, I'm going along. I grew up on a farm in Illinois, one of 5 children, a pretty happy, healthy childhood. And then I went to medical school, also the first in my family to do that. My mom was a nurse and my sister was a nurse, but there was no medical doctors. But I knew somewhere that I wanted to really learn medicine and change the way we do things. I kind of grew up with like a organic garden and we did not run to the doctor as the very first thing. So we had a lot of modeling of a more holistic lifestyle. We weren't anti-medicine at all, but I kind of went into medical school with a thought that I could learn the best reimbursed system in the US, at least at the time, but also start to make changes and think differently. And I'm real excited that I've been able to kind of bring some of those things about in the world of medicine. However, what I didn't know was in my 3rd year during my surgical rotation that I would find a lump on my breast. At 25, you don't think about cancer, but it ended up being aggressive breast cancer. And now that's 20 years ago. But at the time, I was the youngest one diagnosed at Loyola University in Chicago, where I went to medical school. So it was quite an ordeal. And I went through 3-drug chemotherapy, pretty much as they could give me before my heart would stop beating. I got that dose. And then I had surgery, radiation, and took 9 months off of medical school to really do the treatment. I lost all my hair. It was brutal. But I also feel like the lesson that I learned there was I was faced with this life-threatening illness and I had the data at the time and I knew that I would just make a decision and move forward and never ever in my rest of my life should I live a second guess that. And I think that's another important thing because medicine is not black and white. Everyone is often faced with these things of what should I do? Should I take this med? Should I take a biologic? Should I treat it naturally or whatever it is? And we have to kind of take that, get the best information, maybe get a couple consults, and then make a decision and never ever have this second guessing. Because the truth is, while it might have saved my life, I'm still dealing with immune sequelae and immunodeficiency that has lasted probably the rest of my life will last. And it could be partially from the treatment. But I have no regrets because it also saved my life. So that was part of the story, part of the learning. And then as you would think, I'm in remission for breast cancer, going back to finish medical school. And life would be all rosy. But within 6 months, I'm still kind of healing from all that toxic chemotherapy, and I'm in the ER. I had had cyclical abdominal pain and bleeding and symptoms, but chemotherapy is so brutal to your gut that you really don't think much of it. You're like, I'm just healing from this, chemotherapy that I had. But I ended up passing out one day and ended up in the ER with an abscess. And I woke up to the surgeon telling me you have Crohn's disease. So that was the second of two diagnoses in medical school. But once again, I used my training and just dove deep and found that the microbiome, the diet, that all of these things, inflammation, genetics have to do with inflammatory bowel disease. And within several years, I was completely symptom free. And now, 20 plus years from that as well, I consider myself cured from Crohn's and in remission from breast cancer.
The first time I heard you speak was on the microbiome, and you were talking about that story. But then something else happened to you later that was a shockaroo and very unexpected. You had toxic mold exposure. Tell our listeners about that.
Yeah, so I recovered from Crohn's and cancer and finished medical school, went on to residency, started an integrated medical center in Illinois before I moved to Colorado, and life was good. And when I moved to Colorado, I was skiing and hiking and just doing things to the full and living life and very healthy and robust. And I moved into an office in South Boulder. And in 2013, there was a massive flood in Boulder and it affected my office. And unbeknownst to me, this Stachybotrys was silently growing in the basement of my office. And I knew that something wasn't quite right. I was having more brain fog, having more infections, having more just the typical stuff for mold. And finally did some testing and figured out that I had a pretty massive mold exposure that was taking me down. And that was in 2014 and 15. And that really led me down the path. I had to once again figure out how to heal myself. So in that process, I became the mold expert and have really dedicated my life and passion to helping other people because it's such a mysterious thing that people don't feel well. They don't know why they don't feel well. In fact, Dale Bredesen, who does Alzheimer's, who's written so many books about it and does the Recode program, has said, 1 in 3 people who are younger who develop dementia have mold exposure.
Yes, Dr. Bredesen was on the podcast in episode 212, 10 or 12, and we talked about a sneaky mold exposure and just that being part of the cognoscopy that he recommends, even starting at age 35. Well, Dr. Jill, I've learned really about mold from you. And one thing I think our listeners need to hear is that it's often the last thing anybody considers. And you believe if you don't live in some creaky old house, that it's impossible. So, what other possible mold exposure modalities are there?
Yeah. So this is really important because first of all, I always ask a timeline. I'm sure you do as well. Like asking the patients, when did you last feel well? That can tell a patient a lot. Even if you're listening out there and you haven't seen a functional doctor or someone in this realm, you can literally do this yourself and look back and say, well, when did I last feel well? Was it, before the death of a parent, or was it before I moved to a different home in a different state? Or was it, so there's usually life stressors and environmental changes. And as we map out our health in relation to these things, often we'll get big clues. And me as a physician, I'm kind of a detective because as I listen to the patient's story, I'm listening for clues in changes in their environment, changes in their health, changes in their relationships, changes in their stress levels. And I'm trying to put together a story to retell to them and ask them if it feels true. Because often I'll hear a story like, well, I was fine until 8 years ago when we moved to Montana and this big old house had to remodel and there was a dishwasher that leaked into the floor and we, cleaned it up the best we could or whatever kind of story. So what kinds of things might be clues? Well, attics or crawl spaces, any area that's not well maintained or has water intrusion or leaks and has a continuous airflow to your home is like an envelope. And if there's any breaches or barriers to that envelope through crawl spaces, or say you have your furnace and air conditioning in a crawl space and you're pulling air from that space, well, that space has to be clean. If there's mold in it, you're pulling air from it. So it's not okay for that to be just an extension outside of the house. Same with attics as well. And sometimes insulation gets wet or damaged. Sometimes there's leaks in your roof. And then things like windows, things that have water supply. So commonly tiles that aren't properly installed with a water barrier, bathtubs that leak, showers that leak, or showers that are brand new homes that don't have a proper vapor barrier behind the tiles so that everything leaks right through the grout into the drywall. People don't even know it. It's a brand new home. I've heard so many stories of kitchens where they put in the cabinets and drill right through the pipe So someone wasn't really thinking when they were installing the kitchen counters. And these are, again, surprisingly, the most common places, often new homes. And that shocks people because they think, oh, it's a new home, it's fine. But if these construction errors are done, or if the lumber's sitting out in the rain, and you take that wood and put it in the house, and then, like I said, showers, tubs, sinks that leak, dishwashers, fridges. I've seen a lot of fridge lines that weren't properly installed for the ice maker. They go into the wall. And eventually, one of the most funny stories I've told is a young lady who had mushrooms growing on the floor of her kitchen by the edge of the wall because the fridge had leaked into the wall. And of course, there was water. But if you find mushrooms growing anywhere in the house, that's probably a sign that there's an issue.
Oh my goodness, that is wild.
Yeah.
Well, I just recently saw a patient referred by a functional medicine physician who had just was in a new home and did a timeline. And sure enough, it was mold in a brand new house. And that's just so shocking. Well, what about mold in terms of breast implant illness? Dr. Jill, I've been seeing a lot of breast implant illness. What are you seeing?
Yes, me too. And it's funny because I have no like bent either way if someone wants to get implants. And I've even talked to patients and helped them navigate those decisions. However, there's a couple things. First of all, there used to be silicone implants that were actually recalled. So it's much less common now to have a fully silicone implant because many times that silicone will leak into the tissues. And silicone, we can see, is an immune adjuvant, which means for many people who are sensitive, that just like aluminum in a vaccine, there are these things that just trigger the immune system on purpose. Silicone can be one of those if it leaks into the tissues and then triggers the immune system, or the immune system thinks it's a dangerous stranger and starts to react. There's also even saline implants that have a barrier that's silicone, and that can also leak. So even if you have saline, you're not completely safe. And then what you mentioned is a bigger issue, and I've seen these where patients get them taken out 10 years later and they're black with mold inside the saline reservoir of the implant. And I don't know if that's a manufacturer defect because not all of them have mold, but definitely a small percentage of them do. So once again, if you were doing a timeline, you said, well, I got breast implants 15 years ago, and 8 years ago or 10 years ago, I started feeling very poorly. Or if you check toxic load, mold will often trash the detox system, the glutathione status, the NAD. And then, so anytime you have these other exposures, with which we all do, parabens, phthalates, heavy metal, silicone, and you name it, in our just diet, plastics now, and PFAOs, when you have those exposures and you also have mold, it tends to be a bigger deal because the mold has trashed your detox ability. And because of that, those with issues with mold often have higher toxic loads because of the mold.
Well, and I would think it's sort of the terrain theory that the more toxic load, the more susceptibility and vulnerability to everything else, right?
Yeah, I always think of it as the bucket capacity. You probably heard me talk about that in lectures where we all have the capacity. We're born with a bucket ability to detox. And that bucket, as we, enter our teens and 20s, starts to fill up. And when it starts to spill over the top, which for each human, just because of genetic differences, exposure differences, and gut microbiome differences, it may happen at a different time or it may not happen at all. I always talk about the 95-year-old that we all know that's sitting there with a gin and tonic in one hand and a cigar in the other, and he's fine. He has no toxicity or maybe no known toxicity, seems pretty healthy. That person was probably born with a large capacity to detox, or just over a lifetime less exposures. Whereas someone like me who grew up on a farm with chemicals that were endocrine disruptors ends up at 25 with her bucket overflowing. And that often leads to autoimmune disease, cancer, and neurodegenerative diseases, which are all three on the rise. So as that toxic load increases, which could also be the breast implants in someone who's susceptible, and then that toxicity spills over the top and creates a big issue.
Well, and you talk about in your book so with such clarity about the impact of trauma on that bucket. Expand on that, please, Dr. Jill.
Yes, so I love talking about this because functional medicine, with the root cause of illness, and I always think of it as infectious burden and toxic load, how they interplay on the immune system to create dysfunction, inflammation, and et cetera. One thing we haven't always talked about, although more and more it's becoming a common topic, thank goodness, is trauma. Because trauma can also be part of that toxic load and filling up that bucket and spilling over the top. And typically, even if we don't have big T trauma, so, horrific abuse or neglect or any of those things, most of us have some sort of trauma. And some of it might be related to chronic illness or it might be related to multiple siblings and parents that were just busy. These aren't horrific events in our life, but they're things that left an imprint. I'll just give an example for me. I had an incredible family, high achieving, and for some reason, my parents were wonderful. And I know now and knew then that I was loved unconditionally. However, somewhere along the lines as a younger child, I started to equate love with achievement. So I had this like stamp on my brain and system that felt like, oh gosh, I have to get straight A's and graduate with honors and go on to medical school if I want to achieve love and success and all those things that go along with feeling connected to people. Now, again, my parents loved me regardless, but somehow that was a traumatic thing that affected my workaholism in a way, right? Because in order to be loved, I had to achieve. And I've really done a lot of work on that so that now I can rest. Now I can not be working all the time. But those are the kind of things that really affect us. And if we don't address them, it can be a big issue because our immune system is on alert. So I always say, for example, mast cell activation is becoming more and more common. This is where these primordial cells that are called mast cells start to react and throw out their prostaglandins and histamine and create rashes or gut permeability or heartburn or brain fog or fatigue or any number of symptoms. And those mast cells by nature are on the alert trying to sense the environment. And one of the pieces of everyone with mast cell activation disorder is trauma because the trauma sets those alarms and puts them in a state of fight or flight. And even if I do take out the toxic load, treat the infections that are contributing, I still have to make sure they're working on their trauma because that's a piece of the puzzle as well.
Yes, I've heard you talk about in the sequence of working on things that dealing with the limbic system, dealing with the stress is the first thing, right?
Yeah, I always say, gosh, that has to, and again, 20 years ago, you wouldn't have heard me talk about that because in time I've developed, wow, this is really important. And thank goodness many doctors are talking more about it, but it really is kind of that first line. And just to be clear, I'm not a behavioral therapist. I'm not a cognitive, I don't have those skill set, but I know enough to recognize in the patient and then give them referrals to the people who are experts. So it's not that I'm doing all the work. And nowadays there's online programs, there's binaural beats, there's medical hypnosis, there's neurolinguistic programming, there's EMDR, there's so many resources. Even vagal nerve stimulators can be a part of that. So patients can often do the work online or start doing the work online, get a therapist, get someone professional to work with. And there's so many ways that they can start to calm their system and deal with that trauma.
There's something I may misquote this, but in your book you said the body whispers before it screams. That
Yes.
I might be a
Yes.
little bit off. Is
Yes, this is true. So our body will always it's so interesting 'cause even with me. So I, grew up on a farm and the farm, the ethic there was hard work, don't complain, buck up. I had brothers all around me. So it was a very mentality and it gave me strength and resilience. So don't get me wrong, it was a lot of good stuff. But the downside of that was it was hard for me to rest. It was hard for me to give myself a break and it was hard for me to pull back from feeling like I had to overachieve and overwork. So because of that, I really had to relearn. And part of that was being kind and careful with myself and allowing myself to rest and dealing with those trauma pieces that were kept me on the hamster wheel. And I think there's so many women and men out there who are in that world that can really, really relate to that. And all that, again, when you deal with the trauma, you can actually live in a different way that doesn't put the pressure on yourself.
Yeah, I think, Dr. Jill, that's so common among medical professionals like you and me that really want to help people, that really care about people. We take it all on ourselves that we have to do everything, can't say no. Those are basically false belief systems. So people have to evaluate whatever false beliefs they have.
Yeah, it is, and you alluded to this whisper before it shouts, and I didn't really address that directly, but the truth is back in medical school, I, graduated, went right to undergrad, then medical school, and during undergraduate, I got married. Adopted 3 stepchildren in the marriage, and started helping raise them and in med school, and so I look back to that, and I think in hindsight, I was a super highly sensitive person who needed rest and needed space and all these things, and I just suppressed all of that in order to show up for my husband at the time, for my stepchildren, for the medical school, and back to that. And because of that, I really think that a piece of the psychological puzzle of me getting breast cancer and Crohn's was my body literally tapping and saying, "Hello, we need you to slow down. And if you don't slow down, we will make you slow down."
No, it's so true. I just finished reading Gabor Mate's book, When the Body Says No, his older book.
Yeah.
I just received his newer book, but it is shocking, and I could so relate to that too because, I mean, even if you were just doing medical school, that is gonna be a full bucket alone,
Yes.
not even counting, 3 stepchildren in a marriage and
I
everything
know,
else.
it's been great, and I just to be very it was lovely. I love my stepchildren. I was so grateful to be a part of their life and to raise them so that was there was nothing bad about it. I wasn't, like, complaining, I wasn't, like, unhappy, but I was pushing myself way beyond limits, and you mentioned medical training because I think anyone out there who is a medical professional listening can relate to this as well. Our medical training is so dysfunctional. It creates even more dysfunction along if you think about it, like, as a surgical resident, you're taught to not pee, not eat, not drink, not sleep, like, all of our basic necessities. We are taught how do we deny our needs to the nth degree so that we can show up for patients, which is altruistically wonderful. But the truth is, if we get that disconnected from our basic needs to urinate or to eat food or to sleep, that's really not good for our bodies because we're subconsciously telling our bodies we are not worthy of care. Just like basic things.
And it's gonna scream back. I remember being a third-year dental student, and they had the faculty had people come in and get pictures of their smiles. So they had me come in and get, a picture of my smile. Well, a few weeks later, we were having finals week. We had 8 major exams and 13 quizzes or something. And they called me to come up for pictures. And I was like, I'm looking really bad. I don't want to have any pictures made. But it was because I had a giant fever blister on my lip that was so big I could see it. And it was totally exhaustion.
Yes.
I mean,
Yes.
my body was just saying, "Take a break," but there was no way to take a break. And I remember thinking, "This is the most horrible modeling experience anybody could ever have, is to be known as the fever blister model." And so but that's exactly I mean, yours was much bigger. I do not want to equate to what you went through, but our bodies do scream, and you do such a beautiful job and unexpected telling people to listen, pay attention, make your own timeline, and don't ignore these needs or you're going to be, down for the count. So you also just have a gift for simplifying things. So you talk about clean air, clean water, clean food, and then you've added to those, is it clean thoughts and
Meat body, yes.
yeah, clean mind and clean body. So, give us the rundown on those, Dr. Jill.
So that came about because when I talk about environmental toxicity, I'll even go back to my mentor. So when I moved to Boulder, I used the same office space as Bob Roundtree, who has been you call him the king of
Yes.
optimists, and he's been around forever. Just a
Part of
great,
that,
yeah, exactly.
uh,
And a great teacher and just a great mentor. And so he allowed me to come into his office and share the space. We were medical partners for several years. And I remember, when he would talk about environmental toxic load and give these lectures, I mean, it was kind of depressing. And he's a funny, great, like one of my favorite speakers.
yep.
But it was so overwhelming, toxic load, and like, okay, what do we do? We're all swimming in toxic soup. That I realized, oh, this is very depressing. And he would give things to do. But I realized when I started taking on that cloak of I'm an expert on environmental toxicity and I talk a lot about it, that just talking about it gives people more fear and creates more angst. So I knew that I needed to create some very practical things, especially for the average patient listening, of what to do. And that's where it came about because not everybody can afford to go to a functional doctor or get the lab testing to test toxic load. And you don't even need to know all the things in your bucket in order to start. So when I talked about clean air, clean water, clean food, it was just this way where people, as soon as you hear that, you're like, oh, wait. I can do that. It gives us empowerment around a topic that could be very disempowering. So, clean air, 80% of the environmental toxic load is through the air that we breathe. That always shocked me, which means simple things like getting an air filter in your bedroom. You want not only a HEPA filter, but a VOC filter for the volatile organic compounds that are 2.5 microns and below. That'd be like formaldehyde or smoke or mycotoxins, even. Make sure your furnace filters change regularly. I get the highest MERV rating that I can fit into my furnace. And then I change it every 3 months. I put an alarm on my or my clock, my phone, and then I can just know to change it. And then just making sure when it's nice outside and there's not smoke or fires or other pollens, opening your windows and getting airflow into your home is a good idea. If there is, say, wildfires, you want to close those windows and make sure you create a safe space with lots of filtration running. When we had the wildfires here in Colorado, which has been many times, I've tested, I have a handheld meter, and it was like 10 times the amount of particulate outside versus inside on the worst day. days. So it really, really does matter. And then clean water is just, we want to avoid plastic water bottles, plastics of all types, if at all possible. Ideally, a whole house reverse osmosis filtration system. And if you can, at least like a fridge filter or a countertop filter. I never drink tap water. And I've tested enough patients who do to show the toxic levels of things like perchlorate, which is a contaminant in city water sometimes, and other things. And then clean food. And this is a whole nother avenue, but really just whole foods as much as possible. I like to get local, organic, farmers market kinds of things whenever possible, and avoiding things like farmed fish that often have parabens and toxic metals and things in them. So just trying to eat as clean as possible. And those things, and then clean mind is really the thoughts that we think, the mindset that we have, the ability to deal with our trauma and to own that. And then just to show up the best that we can. And clean body is all of these things and the kinds of things we put on our skin, the chemicals that we use in our household, and making sure we don't have toxic mold and all of these things that affect our body.
That's so great, and that is so doable for every single person listening. Now, in your book, I really appreciated how you shared your personal faith, your Christian faith.
Mhm.
Tell us how that was part of your healing, Dr. Jill.
Yeah, thank you for asking because I love it when I can share
I want
openly.
to hear everything about it. Our listeners want to hear everything.
Yeah, so I grew up in a very Christian home that was very close knit and loving, and I always remember, I just had this deep faith that God was always with me, and that was a very great comfort from like probably 4 or 5 years old, as early as I can remember. And I think a lot of people ask me like mindset and cancer and these things that I've gone through and that many people have gone through. And I really believe that if we always have this belief in something greater than ourselves, and then we also believe that there is more possibility than what we see right in front of us, it does affect outcomes. And for me, when I first got diagnosed with breast cancer, of course, I was 25 and I did not know if I was going to live or die. I could have had 6 months or 6 years or who knows. But in the beginning, I remember on the radio hearing a pastor that talked about, I can't remember even the sermon that I heard, but in the end, I remember a verse, and it was, "This sickness will not end in death, but it's for the glory of God," from Luke. And I remember just like hearing that. And for me, it was a word that I received and heard so clearly. And from that moment, I just knew in my heart that I was going to survive, and that if I survived, I had to look at this as a way to, how can I bring God glory in my life through this experience? And what it was God gently and lovingly teaching me that every single trauma, every single struggle, everything that's difficult in our life, if we look and search for the goodness and the lesson in it. And I am not saying that suffering is good. I'm not saying that, people who are suffering shouldn't, deal with the tears and the sadness and the loss. But I am saying that no matter what, I always think of Viktor Frankl, who had such a more horrific experience and wrote about it in Man's Search for Meaning through the Holocaust. Like, who can compare? My suffering certainly does not compare to him and many people who have suffered far greater. But what he talks about is this mindset, the ability that no matter what man does to us, or what illness does to us, or what suffering, financial loss or loss of loved ones, none of that can compare to the internal compass of I think of it like a grounded anchor in belief that we're going to be okay, that we always have resources, and that we always choose how we show up in the world. And that framed everything and then everything since. And now at this point, Debbie, I really believe that, gosh, I don't want to suffer. I hope that I don't have to suffer. But if I do, I can't think of anything, including death, that could come that would scare me so bad that I would lose that anchor. It's so strong. It is the strongest thing in my life. And from that, I really developed, like at the core of my clinic, it's a secret, but it's really not. I know my purpose here, and it's not to teach functional medicine. It is to glorify God and love people. And if when I teach in the lectures or write a book or talk to someone on a podcast, if I can try my very best just to glorify this higher power that has been so good to me and love the people that I get to come in contact with, that's the most powerful healer in the world.
No, you make that very clear, and I appreciated that about your book because I don't think we talk about this enough. I think it's essential to have a biblical eternal perspective and not be afraid to die in order to fully live. So many patients I've seen, Jill, that are just, they're just so afraid they're going to die. Well, I want to say, you are going to die.
Yeah.
I mean, it might not, hopefully it's going to be a long time and you get to enjoy your life, but like that is not something to be stressed out about because it's going to happen.
Right.
And so thank you for being bold about this. And I always say Viktor Frankl's one of my favorite dead
Yeah,
guys
you too.
because he had logotherapy for our listeners, and he said, you know, three things got him through Auschwitz. He said you have to have a purpose beyond yourself, an eternal perspective, and a few good friends that love you unconditionally. Just a few. You don't need 1,000, 10,000 followers on Facebook to really just be happy. You just need a few people that really have your back. And I think that's so key to healing.
Yes, and now more than ever, as the age of AI and things change so rapidly, the data still shows that again, it's so easy to feel like, oh, so many followers or all these people. We just really need a few close connections in order to be happy and live well. It's not about the money, it's not about all these things, which make life easier, but really and like you said, the higher purpose. So having a meaning and purpose in your life, having this perspective that's way bigger than us, and then having those close connections. And I think, Debbie, more and more in this age of AI, that is going to be the thing people are seeking is connections, human connections.
I do too. And I think it's such a huge part of healing, this whole mindset and just faith. You talk so boldly about your faith. In fact, the subtitle of Dr. Jill's book, folks, is Finding Resilience Through Functional Medicine, Science, and Faith. And, you know, that most people leave that out. And it's really the most important thing. And you make it clear, Jill, and I appreciate that God didn't cause your problems,
Yeah.
but your faith in God got you through your problems.
Yeah, I actually love that you say that because that's kind of where I'm at as far as I don't think that God causes suffering, and people out there who are listening are suffering and like, well, if they might be angry at God or any of those things. But when we take what happens to us or for us, we can say we can actually shift that instead of saying it happened to us, it's happening for our greater good, and start to find what I've realized in every single difficult circumstance I've gone through. There's been a massive teaching and blessing through it. I would never have the platform and the ability to teach as a physician or to see patients without the breast cancer and Crohn's because it gave me such a deeper understanding of medicine as the patient. I would never be able to write the story in the book or all of those things. And I didn't realize it at the time, but now looking back, it might have been some of the very greatest gifts in my life.
Jill, I remember the first time I saw you. I mean, I was going through the fellowship at A4M and, you're kind of looking at the schedule. And then you were like, and at 25, I had breast cancer. And, eh, yes, immediately you're like, what? This beautiful young woman had breast cancer? I mean, medical school, dental school is pure torture you don't have any time. The joke is you don't have time to go in the bathroom without a book.
Right.
And, you don't have any time. And so, I was just mesmerized by your story of courage and your vulnerability, your authenticity. I mean, cancer's one thing, breast cancer's something else.
Yeah. It's funny because now I've been through it enough to, be okay talking publicly. But I remember even when I moved to Boulder, I had not, that was 2015. So 10 years ago. No, I'm sorry, 2010, 15 years ago. And I knew that I had to start to get a practice in a new place. And so one of the first things I did was go public online with my story. And it was terrifying, Debbie, because back then, now I just tell it very frequently. And it's been part of what God's given me to share with people and encourage people. But I'll never forget in the beginning that to be that vulnerable and share so personal about something like that, it was so scary because I'm actually quite a private person. But what I realized, and this is where your listeners who have a story, we all do, it's so important because people are all people and people all have suffering and people all have experiences. And when we start to share, it gives other people permission to be in it just like we were and to struggle just like we did and to overcome just like we did. And unless we start to share on that level, we're almost holding back, almost like wearing a mask. So I think it's really important that we share on those levels just because it validates other people's experiences.
It does. And when you show people that you don't have to live in fear, then that's so big. There's so many good studies about just how fear hijacks that limbic system, that whole stress response keeps people in high cortisol. And that fills the bucket up so rapidly. So you've already emptied that part of
Yeah.
the fear bucket. And, we don't have to fear death. And that's huge for
It
health. That's
is
a huge block.
huge for health. It really, really is. And I do things like I climbed a mountain with my first time rock climbing. I do some kind of crazy things sometimes, but there's a piece of that that's like, you know what? I'll be okay. Somehow I'll be okay. And so it gives life a little bit of flavor and adventure as well.
Oh, yeah. I mean, for my 65th birthday, I was gonna skydive. I haven't done it yet. I'm 66 now, but
Wow.
hey, cowabunga,
Right, right.
it's gonna be fine. But like, oh, what if you die? What if you die? And I'm like, you know,
Right.
I'm
You're
not gonna be,
smiling.
but yeah, I'm not gonna be stupid about it. But yet, it does. I think faith just is so freeing.
Yeah.
And so often as Christians, we we portray that it's the opposite of
Mhm.
and so I appreciate that you're sharing your faith so openly, Jill, because people need to hear it, and it's so much the part of the healing message. I want to touch on one thing that I heard you talk about it for clarification. I do GI maps on people. I do oral
Mm.
DNA and GI maps, and so I help people with their gut health. And I see high anti-gliadin IgA a lot. So for any of the listeners that know me, I talk about anti-gliadin IgA a lot. But I'll see it often high on a patient who actually has been gluten free. Um, I don't
Yes.
know. I don't have everybody be gluten free, but if anti-gluten IgA is high, of course we think, okay, cut out gluten. But from what I'm learning from you is that could be a sign of mold exposure. Is that
Yes.
correct?
Well, again, sometimes I pull in clinical experience where I don't have a randomized controlled trial or even maybe the test company that says this is for sure what it is, but I've seen hundreds of cases where what happens with mold is mold can increase mast cells that we talked about, and it can also massively affect the permeability of the gut. So often mold will, by its nature of toxicity, create more permeable gut. And then you have all these antigens like lipopolysaccharides or coatings of bacteria or yeast, or even if there's mold colonization that leak into the bloodstream and start to create immune reactions. So I was puzzled the first time the patients swore they didn't eat gluten and they looked at hidden things and I really believed them. They were someone who was just absolutely devout in their gluten-free diet. And they had this very high SIGA for gliadin. And I was very puzzled. But then as we realized the mold exposure, I thought, well, I wonder if that massive toxic effect creating a more permeable gut is creating a response. And we also know that things like candida can mimic gluten and create a response. So someone who is born with the celiac genetics and then over their lifetime maybe gets at some point a candida overgrowth will start to develop kind of a celiac picture in their 20s, 30s, 40s later on because that candida antigen stimulated that anti-gliadin and then all of a sudden they were reacting to gluten. And my thought was that maybe this person with mold was actually getting such a permeable gut they were creating these antibodies even despite not having a gluten exposure. And there's also we know from like some of the Cyrex testing, things like oats or tapioca or potato, which are all gluten free, can cross react and create a gluten response in those who are sensitive. So as I put that all together, and then I started seeing more and more, and pretty much 100% of those that I saw that claimed they were not eating gluten had pretty significant mold exposures. So I've come to think again in my clinical experience now that those are likely related to mold exposures.
Fascinating. So, for our listeners, those of you who are thinking, oh my goodness, do I have a mold problem in my home? Dr. Jill, tell people how they can do some simple dusting to get some answers.
Yeah, so once again, I don't like to make this very complicated or expensive. So here's the layered approach. Number one is history, timeline. Do yourself a timeline because that alone is probably my biggest clinical indicators when I listen to the story and it fits with an environmental change like a home or a water damage incident that was never properly remediated, and then them getting sick, especially autoimmune disease, fatigue, pain syndromes, and a cognitive decline. Those are all real common things. Second would be visual contrast tests you can do online for free. I do it in my office, and this is a test that checks for visual acuity and like black and white lines in your ability to differentiate. And it was developed in the 1940s as a biological warfare test for those who are in the armed services. So it's a legit test. It's not specific for mold, but it can detect a toxic exposure like mold. So if you fail that test, one more clue. So those two things are free. And then what you're mentioning, Debbie, is I always have patients do a dust sample, which is qPCR, qualitative PCR. There's several companies out there. I think Envirobiotics and the dust test is one where you can just purchase a dust, like a cloth. get dust from your home, and then it checks it for DNA. And then I frequently also test urinary mycotoxins in the patient to see if they're excreting mycotoxins. Those can have false positives or false negatives, depending on if you're not excreting very well or if you've had a ton of food with mold in it. But generally, if they correlate with the dust sample, I've got a case that's likely mold. And then we look at remediation. There are also innate immune system markers that I still test, and physicians are kind of controversy on this. This does require a lab and insurance to cover it. Things like MMP9, TGF beta, MSH, ADH and osmolality, C4A, C3A, and there's a few others, but those can also be tested. So when I'm testing, I look at all of that, but it can be as simple as a dust test or a urinary mycotoxin test to see if you might have exposure.
So listeners, if you think you might have exposure, read Dr. Jill's book, but also follow her on all of her social media outlets because she's going to be giving great information, and you're so generous with free information. You really empower people to figure it out, because I think a lot of times people go to the doctor and I'm tired and they're just going to get antidepressants or, maybe get blown off rather than be listened to like you do and really try to get to the root of this.
Yeah, if you're not feeling well, keep seeking. There's a lot you can do on your own, and then find a doctor who will listen and maybe do some further testing, because it's sad that there's so many that really don't know the deeper causes like mold or other environmental factors. And if the basic blood work looks okay, they're going to be like, okay, you're fine.
Yes, and you're not fine. So listen to yourself, trust yourself. That's, I feel like, a part of what the Holy Spirit does, is just tells you not to give up. So thank you, Dr. Jill Carnahan. It's been a joy to have you today. I know you've got a really tight schedule with your international return, and I want to honor that. And listeners, thank you for joining me. I think we're now in about 144 countries, almost 6,000 cities, and that's because you're sharing this. I'm trying to be better at social media, so join me on Instagram. Join Dr. Jill Carnahan on Instagram, and she has a robust website that you can find all kinds of great courses, great things to learn. And just tell your friends, we want to live with vitality. We want to age fearlessly and not fear death.
Yeah.
Blessings until next
Thanks
time.
for joining us on Vitality Made Simple podcast. Be sure to visit drdebbieosment.com for our courses and resources designed to help you feel better, look better, and enjoy better relationships. Please remember to like, subscribe, and share. Thanks for joining us.